Are you curious what the difference between a 911 ambulance and a transport ambulance truck is? Don't click away, because in this video we're going to go over some of the differences between a 911 ambulance and an interfacility transport ambulance. Alright, before we get started, if you find value in this content and you love all things EMS like I do, make sure to hit that subscribe button down below. But also, while you're down there, make sure to hit the notification bell to be notified when I post EMS videos, and I do it every single week. If you're interested in learning about different opportunities in the EMS field, or maybe different ways to be employed, make sure to tune into this video, because I highlight 30 different ways that you can be involved or employed with the field of EMS. Disclaimer. I feel like I have to put disclaimers on every video because people get upset over everything these days. So I just want to make it clear, even though I've worked in both capacities, 911 ambulance, interfacility transport ambulance, I don't know everything. My experience may be different than yours. So if you can think of more differences, be sure to comment down below and tell me what they are. Most people are familiar with 911 ambulance services and their function within the community. If there's an emergency or what a patient deems an emergency, 911 is dialed and an emergency response is activated. Typically an ambulance responds and they take the patient to the hospital or medical facility that is most appropriate for this patient. But there's a side to EMS called interfacility transports, or interfacility transfers, or medical transports, whatever your EMS service refers to it as. This is where your EMS service is contacted and the pickup or drop off of the patient is scheduled. This pickup can happen virtually anywhere. It could happen at a prison or a jail, a nursing home, one hospital to another hospital, a home to a hospital, or a home to a nursing home. It just depends on the situation. And they are taken to the location of their choice or of their doctor's choice. Difference number one, the amount of time that you spend with your patient. This varies because in the 911 setting, we want to address any immediate life threats, address the patient's complaints, and get the patient immediately to the hospital. And depending on the size of town that you live in, this could be as short as 5 to 15 minutes. And interfacility transports can be multiple hours, and they can even cross state lines. And a lot of bad things can happen in that amount of time. We're talking ambulance accidents, weather, patient deterioration, patient agitation. And if you've gone on any of these interfacility transports and maybe taken like a basic level psych patient, you have probably experienced a psych patient getting a little agitated. And it doesn't necessarily just have to be a psych patient, but this is just an example I can think of. And it's very nerve-wracking being on a long distance transport with somebody who is going where they don't even want to go. They feel like they're being forced to, and they're becoming more and more agitated. It's a small environment and it can become kind of scary. So keep that in mind. The amount of time that you spend with your patient can be excessively more on an interfacility transport. Difference number two, the patient care. Ultimately in EMS, we want to do no harm and treat our patient right. But in a 911 ambulance, we're basically starting from scratch. So let me just give you an example. Say we arrive on scene and we have a patient that is complaining of nausea, vomiting, overall feeling sick. Let's say we get her in the ambulance, him or her, and take a temperature. She's running a fever. She appears to be really dehydrated and just overall sick. What are we gonna do in this situation? Obviously, we wanna get a baseline set of vitals, some medical history. We may wanna start an IV line, depending on her situation and her medical history, possibly give IV fluids, and also consider the administration of some kind of medication to treat her nausea and vomiting. But for our interfacility transport ambulances, most of this work is already done. Most of the time, the patient has been diagnosed and treated for whatever illness they may have. So they may have orders at this time for what needs to be, maybe if it's like an IV infusion or something like that. So your job at that point is to take vitals, to assess your patient, to continue to monitor them en route, and also to follow any doctor's orders that may have been given to you. And of course, you always want to treat any life threats. So if something arises during that time, you obviously want to treat it. But for the most part, at that point, you're not starting from scratch. You kind of have an idea of patient care and how it's going to go down. Difference number three, the environment. With 911 ambulances, it's a lot different because obviously each call is different and you don't know what to expect. So depending on the level of emergency, it can kind of be an all hands on deck kind of thing. And even at times a little bit chaotic. And just like how we talked about in different difference number 2, the treatment, you most of the time with interfacility transports, you know how it's gonna go down. So you know what to expect. And I say that lightly because in this field, you always have to expect the unexpected. That's just the way it is. But overall, as a whole, it's a little less chaotic and you know a little bit more of what to expect at that point. That isn't to say though that you may not be taking a critical transport. That can definitely happen. Most of the time, if the patient is too critical or unstable, they will fly the patient out. But there are always those circumstances that arise, like maybe the flight crew is busy and there's nobody available, or maybe the weather is bad and they can't fly. So there are times where you take critical patients. It's just not as common. Difference number 4, what kind of calls you will be responding to. A 911 ambulance is probably not going to respond to an elderly woman who just needs a ride to her weekly checkup or her monthly checkup. But an interfacility transport ambulance service could respond to that patient, and there are actually circumstances where they wait for the patient while they go to their appointment and then give them a ride back home. They're going to monitor and assess your patient while they're in your care, but for the most part, you're kind of a ride for the patient to get to their appointment and back. These are circumstances that a 911 ambulance wouldn't really be able to pull off, because think about it. A 911 emergency ambulance needs to go pick up their patient, get to the hospital, and get back in service because they're going to be responding to other emergencies. One other thing I wanted to discuss, but it's not really like a specific difference, there are 911 services that do interfacility transports as well. So they may have a separate truck for it, or they may have like assigned individuals that's all they do. They're just on the interfacility transport truck, or maybe they have a list that they rotate through different employees, but there are the dual services. But there are ambulance services that is literally all they do. That is what they are dedicated to. So they are the ones that are going to be picking up maybe inmates from the prison or the jail and transporting them to their appointments, or maybe from a nursing home transporting their residents to a clinic and back, or maybe the patient was brought in on a 911 ambulance because it was an emergency and they got better and now they just need a ride home. There are services that are completely and totally dedicated to this. Okay, those are just a few of the differences, but if you know of any more, I can't wait to hear them in the comment section down below. Thank you guys so much for watching. If you like this video, please give it a like down below, or maybe give a like for Charlie because he's over there like super enthused for this video. Thank you so much for watching. I will talk to you next week. Bye.